The project I worked on during the NAM scholarship year was developing a patient decision aid for a radiology imaging decision. The patient decision aid is a tool for engaging patients, and specifically at the point of care when a patient has to decide whether they need imaging or not, they don't typically have access to a radiologist. So building a patient decision aid as a radiologist and bringing the expertise of a radiologist into this document can help bring that knowledge into that moment at the point of care where the patient has to make that decision. The patient decision aid that we designed is just one decision aid for this one decision, but it does consist of 3 different documents. So the first document is designed just for the patient. It's written at an appropriate language level that's easy to understand, and it helps the patient prepare for the visit with the doctor to know what kind of questions they might be asked and how they would answer those questions, and then coming to the decision whether the child needs imaging or not. And then there's an additional decision. When the decision is made that imaging is needed, the patient can decide whether they want a CT scan, which would expose the child to ionizing radiation, which is a low risk, or a magnetic resonance imaging test, which doesn't have ionizing radiation but may require sedation. So there might be different preferences that patients have in making that decision. The second document is for the clinician, so it brings the scientific evidence into the document, telling the doctor what they need to examine, what questions they need to ask to determine whether the child needs imaging or not. And then they can share this information with the patient, elucidate the patient's preferences in the decision, and then come to a joint decision. And then there's a third document which explains more background to the clinician, statistics and prevalence of headaches in children, the chances of finding a brain tumor, the chances of finding an aneurysm. Those are all questions that patients bring to the visit, and we want the doctor to be prepared to answer those questions. The idea ultimately is that people take this PDA as an example and adapt it to their local practice, so there's never going to be the one ideal version of it. It's meant to be adapted and used in the local setting. The number one feedback we received, which I expected, was that the language was not appropriate. So I had in the first version, our team had just one document, which had both information for the patient and the doctor. So the doctor's information was very high level medical lingo, and the patient information was simple, but there was very strong feedback to separate those documents to spare the patients all this medical lingo and have it more simplified and easy to understand for patients. So we've done that. The number one hope for us is to have an example that others can look at and say, I want to do something like that. And we're currently working on a white paper, which will be like a cookbook for others to say, this is what we did, and here are the elements of a PDA that you should have. And hopefully that will help others to do the same. I've partnered with the American College of Radiology, so I hope that all the resources will ultimately live with the American College of Radiology. To follow my work and my research, please follow me on Twitter, and my handle is @nkpiano.